As far as the Council of Deans are concerned, this is Race Equity Month, and this is work about anti-racism work that the Council of Deans are obviously promoting, and very, very necessary, especially in midwifery education. My name, I'll start now, is Sam Chenery Morris. I'm a midwife. I have been a midwifery lecturer, and I'm now a dean of a school at the University of Suffolk, the School of Nursing, Midwifery and Public Health. Really excited to be facilitating today on this really important work. I'm sure that most people in the room know that there's growing evidence of racial inequalities in maternity outcomes with women from Black, ethnic and ethnic minority groups, and that those women are 4 times as likely to die in pregnancy than women from white backgrounds. So of course there's increasing pressure from to ensure that there's an inclusive and decolonised midwifery curriculum to make sure that we're giving the best possible care to women from these different groups. So in this webinar today, we're going to hear from the RCM and the group that are here about the RCM's new Decolonising Midwifery Education Toolkit, and consider what measures the HEIs can implement and to make sure that the midwifery and healthcare curriculum is more inclusive. We were just chatting before, and I was saying I'd read the toolkit and I really found it interesting, but there was a few slides that were new to me. So without further ado, I'll hand over to the presentation, and then I'll start the questions, thinking about what I can do, and I'm sure all of the participants as well will think about what they can do. So I'm going to hand over to Jane and Heather in the first instance to deliver the presentation now. Fabulous, thank you, Nadia.
Well, I'll start, and then I'm going to hand over to Jane. My name is Heather Bower, and I'm the Head of Education at the Royal College of Midwives. And if I could have the next slide, Felix, that would be great. So these are the people that are presenting today. And I'm sure we're all going to introduce ourselves as we start speaking. This is a picture of us meeting at the headquarters at RCM, which we've done twice as part of this work. Have the next slide, Felix. So the inspiration behind this toolkit really started with the statistics. So as we all know, if you are a Black woman in this country, you're 4 times more likely to die in childbirth. If you're an Asian woman, you're twice as likely to die. And these are really, truly shocking statistics. And on the back of that, 2 reports have been published, one by Birthrights and one by a small charity called 5 Times More. And both reports called for decolonising of the curriculum, because it's really by starting with education that we're going to make a change to the way in which care is delivered. So we rose to this challenge at the college and got together a stakeholder group of very many people, actually. So on the stakeholder group, we've had students, we've had maternity support workers, midwives, lecturers, professional midwifery advocate representative. We've had our own RCM fellows. We've had Jackie Williams from the NMC representing the NMC, and a representative from the Royal College of Obstetricians and Gynecologists, and from the Race Health Observatory, other lecturers. We've had service users from the Maternity Voices Partnership and others as well. So a huge group of people that got together. And what the group decided was that they wanted to create a toolkit for all midwifery educators, really as a challenge to midwifery educators to really think about the way in which they produce midwifery education. And that's everything from recruitment to how we view practice as well for our students. So as I say, we had 2 face-to-face workshops, lots of online sessions, and we also consulted our RCM members at our annual conference last year. So we've had lots and lots of input into this, and I think that's really important, that it really is a co-produced toolkit. It's not just the RCM saying this is what we think should happen. Next slide, please, Felix. So the aim of the toolkit is to empower midwifery educators to challenge the implicit and explicit legacies of colonial perspectives in all aspects of midwifery education. And colonialism is really embedded in the way that we provide education, but it's embedded in the way that we think, and sometimes we don't even know that. So it has been really useful to have a wide range of stakeholders to really challenge our thinking with this. And we're not trying to say this is what we should do. We're trying to really challenge the way in which we think and produce education. So the toolkit is actually, after the introduction, is divided into 4 sections: recruitment, curriculum, assessment, and practice. And we're going to deliver this talk in those 4 sections. But first of all, I'm just going to hand over to Jane, my colleague at the RCM. Jane, I'm sure you're going to introduce yourself, and she'll talk about the wider EDI work that we're doing at the college.
So good afternoon, everybody. I'm Jane the Queen. I'm the Head of Equality, Diversity and Inclusion at the Royal College of Midwives. Can I have the next slide, please? And we've had lots of conversations with staff and stakeholders and members prior to embarking on this journey to create the Decolonising curriculum toolkit. And we also thought, even having a toolkit that's for external use, what elements of that can we use through the RCM to support our members and give them a voice in terms of race matters? So one of the focal points for us with the Decolonising toolkit, which my colleagues will go into further details, was about bringing the lived experience of our members into the work that we do. So the first big piece of work that we've done, I spent a year speaking to our members about their membership experience at the Royal College of Midwives, and areas of decolonising came up in most of the conversations. So this work was also taken forward at Black Workers Conference in 2021 at the trade union to also collaborate with our colleagues. So we brought the conversations back internally into the RCM, and as Heather explained, we had a wide range of stakeholders which covered the entire UK. So what we wanted from the toolkit as well is something that our staff can use to have conversations and use it as a training tool and educate about having conversations around race matters, using the toolkit to actually listen and speak with members and bring back their feedback and ensure that the toolkit challenges the RCM as well as other colleagues across the UK. So we also have other areas. So we're now focusing on creating an EDI strategy for the RCM, which we'll do similar in getting our members involved and hearing their voices. We have ongoing work with Race Matters. So as you can see, we have winners. We've now got a Race Matters Award where we recognise our members and what work they're doing in the community or in the workplace to ensure they're tackling racism from a membership perspective. Our students have also collaborated with us in different ways. We have 2 EDI champions from the Race and Race Matters Forum, from the Student Midwife Forum, and they represent on a UK level as well and get involved in our work and have been a part of the Decolonising toolkit. We also use our areas in the workplace to focus on topics around race. So bi-monthly, we have a Race to Lunch workshop where we invite any and anybody, you don't need to be a midwife or from maternity services, to come on the platform and speak about issues of race or what you're doing in your area, or sharing best practice for other organisations. And as we encourage others to use our toolkit to stimulate conversations, we're also aware we need to set an example. So we have an EDI hub in our organisation, which is monthly, which we use that platform to challenge ourselves and speak about different topics around intersectionalities and racism, for our staff also to be encouraged to open up conversations with our members. Thank you. I'm going to hand over to my colleagues now. Next slide, please.
Hi, I'm Sian McLaughlin, and I'm a midwifery lecturer program manager at Cardiff University. And with my colleague Karina, we're going to talk about the recruitment section of the toolkit. Sorry, Karina, were you gonna? As a group, we really felt it was very important that we started with recruitment, that there was no point in looking at the theory and practice curricula and looking at assessment if we didn't really start with the recruitment and supporting applicants from the global majority to come onto our midwifery programs, and really making sure that they were supported and represented within that environment. And so, as you can see on here, this is taken from the toolkit. We really wanted to raise awareness around the value of open days and other widening participation events, that actually it's an opportunity to sort of showcase the environment that we're offering, and thinking about sort of representation and thinking about sort of wider groups that might be able to support those events. So, for example, working with EDI teams across universities, so that potential applicants, potential candidates feel that they can recognise themselves in our institutions, and that they feel that actually that's a place that they might want to learn. Can I have the next slide, Felix, please? Thanks. And so some of the elements that we looked at when we were thinking about recruitment, you can see on here. So we wanted to talk about representation. And obviously, this is something that's a really hot conversation, I think, at the moment within midwifery, about the representation of global majority students on our programs, but also within our teaching teams. And that really does vary depending on whereabouts in the UK you are, but it's really important that people feel represented, and so feel that that might be an environment that they want to access. And we felt really strongly as a group, and we talk about in the toolkit, that actually, although we want to support global majority students within our existing student body to support widening participation events, and to sort of showcase their experiences of our programs and their undergraduate education, it's also very important that we don't ask them to do the work for us, and so that we're really recognizing and respecting their time and the pressures that they have on them as a student as well. And so it's about that collaborative working all the way through. And that's right from thinking about open days and widening participation within the community, right through to assessing personal statements when the UCAS cycle opens, and then thinking about how we interview, and then making offers. So thinking about contextual admissions and that sort of thing, and really working collaboratively with students, with equality and diversity teams within the universities, with stakeholders, with the community, with practice, so that we're making sure that there's no inadvertent barriers for to those applications, so that we're not inadvertently excluding any particular group or making the application more difficult, and also having that opportunity to really be hopefully welcoming and open, so that candidates from all backgrounds, but particularly the global majority, might feel that we are approachable, and that they can talk to us about their application, that it's not a kind of closed door situation where only some people know what's going on, that actually, what we want to do is support people to become midwives. That's really important. And so it's about really keeping those channels of communication open. And so we felt from a widening participation approach, it needed to be really targeted. And one of the things that we recognized over and over again when we were putting the toolkit together was that people working in universities and in practice, and students themselves, are really very busy people. Their timetables are full. Our student midwives do incredibly long courses with often 45 weeks of the year. They're working in practice for 50% of that time, and during that time they are working a full 37.5-hour working week, and that's across nights and weekends and on calls. They're really busy people, and so are the people teaching them, so are the people working with them in practice. And so it's actually, we don't have infinite time to take part in widening participation events. So it needs to be really targeted. So working really closely with EDI groups within universities and within trusts and health boards to make sure that we're targeting communities that perhaps wouldn't necessarily go into higher education or perhaps haven't considered midwifery before, so that we're really offering support to people who perhaps want to take this approach but haven't really known how to do it or haven't considered it at all. So really using our time wisely, which obviously makes perfect sense. And then just thinking about underpinning all of that with training, of course, and data collection. So thinking about unconscious bias training, cultural competence training for staff, for students, and for anybody involved in our recruitment process. And this is one of the things that we feel that sometimes when conversations are happening, people make the almost unconscious assumption that they're not biased, that actually, you know, I'm okay, I've been doing this a long time, but actually the whole nature of unconscious bias is that it is, of course, unconscious, and actually just really making sure that that appropriate contemporary regular training is in place, so that we don't make any assumptions about the decisions that we're making or the support that we're offering, and then using data collection to, you know, back up what we're doing, so that as this toolkit rolls forward and different institutions get involved, that actually you know, we have the data to back up the success or where we perhaps might need to make changes. Thank you. I'll hand over to Karina for the next slide, Felix. Thanks.
Okay, so my name is Karina Okiki. I'm a midwife and equality, diversion and inclusion midwife at the John Radcliffe Oxford University Hospitals Trust. And I also associate with Oxford Brookes as an associate lecturer. So continuing with what Shan's just talked about, why are you probably asking yourself, why do we need to then decolonize recruitment? And I suppose you come back to, you know, asking yourself the basic questions of, you know, what information do we know around recruitment? What else do we need to know? What do we need to unlearn or relearn around recruitment? And you start by acknowledging this need, that there is a lack of racial concordance in midwifery. So most of you will be aware in your trust, in your local trust, that our workforce does not necessarily represent the communities we look after in terms of age, race, disability, and all other characteristics. And therefore, then you move on to understanding what impact this has on outcomes. So this has been previously outlined in Birthrights 2022, in WHO 2017, about how this lack of representation then impacts outcomes for people of those different groups. So I put a quote there, and this is taken from a paper that we published this year on choosing midwifery with my colleagues, Louise Hunter, Jane Carpenter, and Jasmine. And it was around the perceptions and experiences of Black, ethnic, and other minority students applying to midwifery programs. And this I think explains more about, you know, the lack of representation and how it's perceived and how other people see it when they come to our universities. And so this student says, I assumed Town X would be very diverse, but the course wasn't. So they're trying to work out why this is happening. So once you then have acknowledged this need and you've understood the impact of why this has to be rectified, and then you can then move on to actively supporting these underrepresented groups. So most people will already be using positive action to support inequalities, focus on equity, equal outcomes, and also to help the underrepresented groups really overcome barriers. And this could be financial barriers, this could be race barriers, this could be, again, unconscious bias like Shan has just explained. And so I know some people probably using contextual admissions. But then do you need to go further? So this is where, you know, do we need to rethink this? Do you only do it with grades and that's that? Do we need to then apply it to personal statements? You know, is this a second language? Will vocabulary matter? And you know, studies have shown that most of the students, even though these barriers exist prior, once they're on the course, they actually do just as well as other students. So it's then bringing your thinking back to, why does this matter? Neurodiversity, if you're doing value-based questions at your interviews, how does it, you know, affect neurodiverse students? So it's applying context, not just to grades, but, you know, taking it a bit further to interviews and other places. And then if you're still looking for buzzwords, you need to take again into consideration the different backgrounds that are coming to see you, and their vocabulary, mixed vocabulary, which can only be a good thing. But if we are just set on the words we want to hear, the buzzwords we want to hear, how does that then affect the outcome of our interviews and the people we recruit? And then, of course, Shan's talked about open days and the feedback we get on that. So I don't need to go through that again. And then also around collaboration. So collaborating with the EDI groups, like Shan mentioned, with our universities as well, our university EDI groups, but also with our local hospitals as well, and seeing especially how we can support recruitment in our catchment areas, but also how we can provide that visibility. So whilst we wait to improve on our staff makeup, which we should be actively trying to improve on, we can also collaborate with other EDI teams around universities and our local hospitals, and also just to get understanding from different people around us. And that's a quote there about, actually a student coming to an open day and feeling a bit positive about what the future looks like. You think, oh gosh, I'm not the only one. And how the impact of sometimes when you are the only one, what that impact has on you, on whether you want to be at that particular university or not. So I'll hand over to the next person.
Thank you. Next slide, please. Hello, I'm Maxine Chapman. I'm a midwifery lecturer at the University of Leicester, where I teach on a 4-year undergraduate MSci programme in midwifery with leadership. So just to say, great to be part of this work. For me, it started when I was able to work with a team, and we published a first-of-kind paper on the assessment of skin tone with darker skin for mothers and for babies, which was an important piece of work. And that kind of led me into being part of this important stakeholder group. And I'm talking today about the curriculum and the importance of promoting equitable outcomes for students from racialised minorities. We need to think about how we can be flexible in our approach to learning and teaching, because we know with student involvement, the evidence tells us that students are more successful if they're involved in that education process in terms of developing materials and so on. It's important, as we know, to diversify our reading lists and increase representation of different viewpoints across our curriculum. What we've been able to do here at Leicester, just to give you some examples, if we could have the next slide, please. Well, first point on this slide is about ethically diverse teaching staff, which has already been spoken about, and the importance of that in terms of creating a sense of belonging and also educational attainment. And we know this is important for our students to feel that they belong, that they will engage in the curriculum. And the most important thing here for me, particularly for most of us on this call, is about what we do to reduce that racial attainment gap. And there's so much more work to be done, but we're confident that some of the changes that we're making here at Leicester will help to work towards that. So, for example, ongoing cultural safety training and workshops for all staff. So at Leicester at the moment, we are implementing, during the induction period, active bystander workshops for all students across the School of Healthcare. So not just midwifery, other programmes too. And within those active bystander workshops, we have scenarios of discrimination against all the protected characteristics. And what we aim to do is provide the students with the tools and necessary skills to be able to call out unwanted behaviours, discrimination, preparing them for what they might entail in practice. Now, the scenarios that we use for that, we've got those scenarios from the students' lived experiences of discrimination. And we've been able, so they're authentic and the students can relate to that. And we hope to be able to provide the students with the skills to challenge any discrimination they see. In addition to that, racial inclusion workshops for staff. So all staff are educated on why it is important for listening to the lived experience of our GEM students, our global ethnic majority students, in terms of understanding what the barriers are, what the challenges are, and why this has impacts on the race awarding gap. And having students as part of a curriculum review, so there's opportunities maybe across some of the universities too, where we actually ask the students to review our curriculum we have curriculum consultants at Leicester, and the students are paid for their work to review the content, and the plan is for them to review the content of our modules and to make sure that we are being inclusive and to highlight to us any areas that we need to change to ensure that we're being inclusive in what we teach. Another activity is the development of a charter within our school to prevent and address racial harassment, which is co-created with staff and will be with students too. And this aligns to the BMA work, the British Medical Association, same charter, but we're adapting that for the healthcare professions here at Leicester. So these are just some examples of how we have incorporated some of the recommendations from the toolkit into our curriculum. There's lots more examples on the website, which I'm sure you'll have the link to see what other universities are doing too. So thank you. I'll hand over to my next colleague, which I think is it Zahira?
I believe it is me. Yeah, thank you, Maxine.
Thank you.
If I can have the next slide, please. Hello, everyone. My name is Zahira Isa, and I'm a senior midwifery lecturer at De Montfort University in Leicester. As an admissions tutor and interim deputy programme leader, I've been working closely with our lead midwifery education to look at our midwifery programme in the context of the toolkit and finding ways to decolonise our midwifery education. And more recently, we've been exploring the assessment aspect of the toolkit too. And the reason for this is because we want to ensure that our assessment is inclusive so that all students have equal opportunities to showcase their knowledge and understanding. And so what we did firstly is started reflecting and considering, for example, if our assessments do perpetuate racial stereotyping and microaggressions, and through our assessments, how we could promote cultural awareness and safety using the lived experiences of women, birthing people, and families too. Can I have the next slide, please? Thank you. So what I'd like to do is just touch on a few aspects that we've been considering as a midwifery team in relation to assessments. And the following thoughts, ideas, and questions are not exhaustive, of course, but just really encourage dialogue, reflective thoughts, and an endeavour to achieve even equity for all. So we know that assessments have the potential to impact the students in a negative manner where they are disadvantaged. And often it is due to factors that are outside the assessment or the outcomes that we are even assessing. So one of the first things that we looked at is the assessment date. So we do set the date in advance and before often the students even start the course or before they even start the modules. And do we really consider the timing of launches, the assessment launch, the assessment dates, and how it coincides with religious and or cultural obligations? So we do not always consider religious festivals and observations outside of the Christian calendar and how it may be problematic for students to have assessments scheduled on these dates. And so there is that opportunity to co-create the assessment calendar with our students. And these are reasonable adjustments that we can easily consider. Another aspect that we have considered is the language that we use and ensuring we do foster culturally safe and inclusive practices, avoiding racial stereotypes, such as the notion that minoritized communities may be hard to reach, or that women have deviated from the norm. Other aspects we've considered are the scenarios that we use, in which sometimes we foster those stereotypes, and it might not be summative assessments, it could be formative assessments, group work in classroom settings, could be anything. For example, stereotypes such as the Asian women and their partners who own their corner shops, for example. And it was during an assessment which explored the skin assessment of a newborn that the midwifery team at DMU realised we needed to address how little reference there was around the assessment of skin of women and babies of darker skin tones. And this is the work that Maxine earlier alluded to. And this included midwifery textbooks and other resources which supported the students' learning. And as we began to explore more in depth, we realised, as have others, how little and inappropriate reference there was. Images for conditions were mainly of lighter skin tones. Assessments that we use often do refer to the colour pink and red, but we will not always see these representations in darker skin tones. And so what we began to do is question Was it possible there was a lack of understanding and confidence in recognizing complications in women and babies with darker skin tones, and if this led to what is being missed? And also then, if this contributed to the poor outcomes that we are seeing. So we do need to address the Eurocentric language that we use. And when creating assessments, including marking grids, ensuring the focus is not only on the white body, but the variations within specific ethnic groups are understood and addressed without pathologizing Black and brown bodies. Often women's skin is being described as being pink, red, or pale, which is fine for women who have lighter skin tones. But we need students to also consider how to describe and what to look for in darker skin tones. And often we do use those tokenistic gestures as well during assessments to suggest we are inclusive in our approach. And of course, our resources and materials for assessments do need to represent the diverse populations that our students will care for. However, what we do need to also do is use meaningful, impactful measures too, such as marking grids that allocate marks for competence in the assessment of, for example, cyanosis and jaundice in different skin tones. And what we've also done is considered whether our assessments encourage students to value and credit the knowledge of authors across the globe. Often Western knowledge is seen as authoritative, and these are the only sources that are allowed or will be considered. Another aspect we've also considered is how we include service users to explore our assessment briefs and ensure that we receive that constructive feedback as well. Now, we do use service users in our assessments and other areas like interviewing candidates. However, an area that we've been focusing on is ensuring that we recruit service users of diverse backgrounds from our local communities. How do we also ensure and monitor equity of assessments between groups of students? We ensure we mark anonymously, but this isn't always possible, especially during presentations and other face-to-face assessments. And so how robust are our internal and external moderation processes? And does it really minimize the potential for racial disadvantage? Now, we do recognise that students are assessed in both theory and practice, and often there are very similar and different challenges in both areas. Nevertheless, recognising that often, there isn't always that safe space for students to raise concerns around equity in assessments, and considering also how we overcome this. Again, as module leaders, often we don't know the demographics of our students. However, this is important so we can monitor the attainment of our students as per racial categorisation and other categories that we've already considered today. Furthermore, identifying the positive steps we are taking in assessment design to reduce the awarding gap of racialised minority groups. Finally, do we have a diverse and inclusive assessment team? And what kind of training, which includes anti-racism training, has the midwifery team and clinical staff had, because they are also involved in assessments? Effective EDI and cultural safety training is vital for all involved in assessment processes, whether this is in theory or in the practice setting. And also the training needs that address racial profiling of students and issues around conscious and unconscious racial bias, and how this can disrupt the ability to achieve fair and equitable outcomes for all. So these are certainly some aspects that we've considered, and there are many more when we need to think about assessments of students, and this certainly needs to be explored under the lens of racial disadvantage. And so by doing so, we recognise that the systems in which we work is deep-rooted in a colonial mindset and has the potential to perpetuate racial disadvantage. So the prompts I've touched on are just some that we at DMU have considered, and this is to ensure, as the toolkit suggests, that we engage in a more critical, authentic way of conversing about inclusive assessment practices, and to help all involved in course design and delivery to reflect on its purpose and design. Thank you. I think I'm handing over to Selena now.
Yeah, thank you. Next slide, please. Hi everyone, my name's Selena. I'm a fourth year student midwife at the University of Leicester. Now we're talking about the practice section today. The NHS Staff Survey 2022 highlighted that Black and ethnic minority staff are twice as likely to experience discrimination from the public and nearly twice as likely from NHS staff compared to their white colleagues. With this statistic ringing true for so many racialised minorities, the practice section was created with the focus of addressing how the experience of global majority and midwifery students could be improved in clinical practice. Life as a student midwife definitely has its own individual challenges, but are the additional challenges of non-inclusive behaviour and intersectionality that global majority students may face recognised? And are there adequate provisions for support? The best practice section identifies and challenges the need for institutions to take action, and now is the crucial time to do so. As a member of the stakeholder group, we had numerous debates on what should be included in this section. So we wanted to just take this opportunity to highlight a few key points to you all. Next slide, please. Students from global majority backgrounds report that they do not always feel safe in the practice environment. This may be due to their experiences in clinical practice, alongside a lack of a safe space and a safe person with training in cultural safety to discuss and raise concerns with. The definition of a safe space is personal to the individual. It may include inclusive imagery in the placement area, the representation of staff members with similar backgrounds, or maybe the ability for racialised minorities to speak freely without judgment. Who students consider to be a safe person may be a personal shooter, freedom to speak up guardian, professional midwifery advocate, or maybe someone who is not directly involved within the institution. All students deserve to feel safe and experience psychological safety within their placement areas. A best practice point discussed was to facilitate safe spaces, which do not necessarily have to be in the hospital ground. But this allows for discussion to take place with safe people who are able to facilitate these sessions. Through the discussions as part of our stakeholder group, it became evident that many students are unaware of the raising concerns policies internally within the university and externally in the wider organisation, with limited opportunity to follow up on the concerns which they raise. This is particularly important in regard to students gaining confidence in using their voice to escalate poor behaviour without fear of repercussions based on their student profile alongside protected characteristics. The ability for students to feel able to engage in courageous conversations to address these issues aligns with the decolonising ethos of this toolkit in striving for a changing work culture. There's no excuse when it comes to the difference in maternity care outcomes for global majority birthing people compared to their white counterparts. However, some universities are based in areas with limited diversity, raising the question if placement allocations could be reviewed in order to allow students to experience cultural diversity in clinical practice. This may mean universities pairing to provide spoke placements, encouraging learning and experience of diverse populations to well equip all students and allow global majority students to experience caring for their own and different cultures. I challenge you as the audience to think about your own organisations. Do students from racialised minorities feel as welcomed into the practice area as their white peers? Are women and families stereotyped because of their cultural background, ethnicity, or religion? Is the need for some global majority students to code-switch, i.e. adapt themselves to the culture in which they're working in clinical practice, acknowledged? Is there opportunity for practice leads and link lecturers to collaborate, for instance, in a joint huddle? Do you encourage students to complete wellbeing checks? And finally, do students feel emotionally and practically supported in your clinical environment? As a future midwife, I hope to see the implementation of the recommendations that the Decolonising Midwifery Education Toolkit has to offer, so that others like me who identify as a global majority see themselves recognised, represented and heard within our profession. And finally, I challenge you all to break barriers and join this journey for change. Thank you. Next slide, please.
Thanks so much. Selena, and I'm just going to briefly summarize. So this is just a poster that we presented at the European Midwives Association conference 2 weeks ago. And we can send this to anyone if you'd like to have a better look at that. Next slide, please, Felix. And we've also got a decolonising hub on the Royal College of Midwives website, which is not behind the paywall, so anyone can access this. And when you get the slides, this is the link. We've also sent a printed copy of the Decolonising Toolkit to every single university in the UK. And I think I need to stress that representatives on this group came from all 4 countries. So it truly is a UK-wide initiative. Final slide, please, Felix. And so our future work, because we feel very strongly that we've only really just started the journey. And so there's lots of more work to do. We're not going to stop with just getting the toolkit out there. But the next pieces of our work really come under the headings of disseminate, evaluate, and generate. So with dissemination, I think we're doing quite well. We presented our work at the International Confederation of Midwives Conference, as I said, the European Midwives Association Conference, many national and local webinars and seminars. Yesterday, we presented our work at the Decolonising the Curriculum Conference at De Montfort University in Leicester, which was fabulous, and we presented at the Royal College of Midwives Conference. And we've also got our work into our RCM journal, Midwives, but we are planning a lot further and wider reach in terms of our future publications. We wanted to give the universities a bit of time to think about this work, but at the last Lead Midwives for Education meeting last month, it was obvious that a lot of people are already really rising to the challenge. So our next piece of work is to evaluate the impact that this work has had, and we're thinking about how we do that at a meeting next week. We also are thinking about whether we have some sort of accreditation for universities, but that's for future discussions. And finally, generate. So we just really want to generate discussion with this work. As far as we know, it's the first piece of work like this in midwifery. And we're very aware that there are university toolkits and even toolkits for other healthcare professionals, but not for midwifery. We want to really challenge, as Selena very eloquently said, challenge people's thinking, both theoretically and in practice, and also in terms of recruiting our profession. And we will be taking this work further. So I think it's important that we don't just publish the toolkit and think we're done, that actually this is an ongoing journey, which, you know, has been spearheaded by the Royal College of Midwives. But as you can see, is you know, there's a very, very wide group of people that we have gathered along the way and have really, really influenced this work. So thank you very much, and we're happy to take questions.
We've got 5 or 6 questions on the chat, which is absolutely fabulous. Yes, loads of food for thought there, and just new ideas all the time, which is fabulous. I'll take the questions in the order that they've come through. So anybody on the panel, you said that you would answer them. So do you think that interviews are a barrier to midwifery, and wider student healthcare recruitment to those from global majority? So does one of our panelists want to answer their experiences or the evidence that we've got for that, please?
Karina, are you best placed to answer that?
Yes. So in terms of interviews and how potentially there could be barriers, it comes down to context. So like I was saying before, we apply our context to our grades, and then we fell short by stopping there. It's still the same person. Most of the time, the same students, when they're sitting the exams, once they're with us, we apply that context into how we support them with that. So in terms of if you're having students who sometimes are applicants who English is not their first language. They will be able to speak it, yes, and write it, but vocabulary might be different. And so focusing the interview on knowing the person rather than on the buzzword and waiting for this terminology. Sometimes we don't hear those buzzwords, and therefore we put that barrier as that person has, failed that interview. And also we know, again, moving it along to neurodiverse students, the speed at which we our interviews, we ask the questions and we expect the answer. Some people need a minute to process, sometimes understand the question, first of all, if English again is not first language, or if there's a spectrum, if they're on a spectrum as well. So it's being aware of all this context. So then I think we have to then look at, what are our markers of context? Are they up to date? Are they reliable? If you're, if at this, so it's looking at that whole picture and supporting that all through our process of recruitment. I don't know if that answers what you are asking.
I think it does, yes, thank you. And we'll move on to some of the other questions. My sound, is it okay? Nadia said it's not as good.
We can hear you, Sam. Sounds like you're underwater.
Very sorry. Heather, you wanted to answer this one anyway. How do we take the onus off the student to have to go through the awful process of reporting racist experiences in education?
Well, I'll start, but I think there might be other people that could come in on this. I mean, I think our toolkit was really trying to move away from this, so I think that is one of the aims of our toolkit, really, that we're not just leaving it to the student, to actually raise concerns or to sort of navigate the whole midwifery education journey, if you like. The toolkit is there to challenge us as educators. So we're trying to move the onus away from the student just by actually having the toolkit. But I know that Karina and Selena, who've both been students as well, I mean, Karina, obviously Selena still is a student, feel quite strongly about the token Black student as well within a cohort, because Karina was the only one, which was influential in, the work that she has now gone on to do with the lecturers at Oxford Brookes. So I don't know if either of you want to talk about the lived experience, guys.
Selena, would you like to go first?
And then I'll add on.
The lived experience, it can be difficult, but I think it's also just making sure as a student that you've got support mechanisms in place to support you. Because I'm quite passionate about just advocating for change. That's sort of where my driver has come from and where I get most of my motivation from.
And just on the back of that, I think the thing we know is that if we have safe reporting systems, that students know that what they report is kept safely, that actually once it's been reported, action is taken. But most importantly, the student knows what action was taken, what was the outcome of their report. Because up until now, I think the majority experience is you might report something, but you don't know what happens with that information. And then it's not fed back to you. You don't then have the confidence because your experience has not been validated. You've raised it. Where does it go from there? So that leads to students not reporting. I saw a question that came up on the chat about, do we have data? Do we have evidence base for reporting? And actually, we don't. We have some evidence, but we know that is not a true reflection. And that's partly because students don't feel safe to report it, because they don't feel protected or don't know the outcome. So what is the point of reporting? So yes, I think that's a lot of work to be done with our practice partners. We have the systems in universities. We've got a lot more to do with promoting those systems, but particularly with working closely with our practice partners, which our students spend 50% of their time with during their training. So more work needs to be done around that to give students confidence to report. Hand over to Karina.
Yes, so I think if I put it this way, I think lots of us will be more familiar with stories of I was the only woman in a boardroom. So if you think of it that way, being that only person, that only characteristics the only woman in a boardroom, the only Black student in a class. It's overwhelming. It's fatigue. You doubt yourself a lot. Did it happen? Did it not happen? Am I being angry, aggressive Black woman and not just seeing it? And you're almost having to teach a whole group around you about why you think it's wrong. And then it's really on them whether they agree with you or not. And it makes it worse if then your teachers are not representative. So there's a lack of people that can relate with you. And sometimes lack of cultural training as well, which does not help. So I'm not saying you need all Black teachers, but you need a good mix. And also you hear from the service users we looked after that they're so happy sometimes when they see somebody that they didn't need to explain something to for so long, that actually just got it. And they don't necessarily just need to be looked after by people that look like them, but they need to have some sort of regular contact, just as other groups have. So it's all fairness, and it's just removing that unfairness on that token student that, overwhelming them with, being in that situation. If you've ever been in that situation, if you've been on holiday abroad and you're the only white person on a bus full of everybody else, it's that feeling. So imagine having that. If you're full-time, it's really almost a certain number of hours per day, a certain number of hours per week for a period of 3 years. It will overwhelm anybody.
Thank you. Yes, absolutely. While we're talking about recruitment, because there's a couple more questions about having more global majority lecturers as well for representation. Again, what can we do to encourage more diversity in our universities as well?
I think this is a challenge, Sam, because as Karina rightly said, midwifery itself is not representative. And if you look at the NMC data on the NMC register, midwifery is a much less representative registrant group than that of nursing or nursing associates. So we've got a problem to start with, and that's obviously why we felt passionately about including recruitment of midwives, students to become midwives. But I think in terms of recruitment to lecturers, I think it's sometimes about people not seeing themselves in that job. And I'll just give you an example of our student midwife forum at the college, and Jane might want to come in on this, but we had very little diversity on our student midwife forum, and that challenged us, Jane, didn't it? And so Jane came up with the idea of having two race matters representatives on our student midwife forum, and we also at the same time had two EDI representatives. So they were representing their region, but they were also representing Race Matters or EDI. And we were overwhelmed by applications, actually. And I'm really pleased to say that a third of our student midwives on the forum are now from the global majority. So I think it's sometimes about making that invitation and putting it out there, not in a well, maybe in a positive action way, but in a way that says, yes, this is for everyone, this is for you too. I don't know whether you want to come in on that, Jane.
Yeah, I was just going to add to that in terms of when we looked through the applications and listened to the manifestos, it also encouraged other people to welcome the intersectionalities. It wasn't just conversations about race in the race areas, because yes, you could be Black or brown. However, you want to advocate for another protected characteristic or anything that you think impacts maternity services or your colleagues in the workplace. So it's started those conversations. And what I'm really excited about the Student Midwifery Forum is because of the diversity within the group, diversity is always a hot topic in all of our sessions that we have. And the students have even welcomed well-being for themselves within the group. What does that look like when you're in a student champion position? What does that mean, and how do they support each other? So I think it's really important, even though we look at it as a toolkit, how does it work for your workplace? And someone mentioned about the students' experience. Are you speaking to students when they finish their training? Are you speaking to students before? What do students want to see? Because sometimes what we put on the tin about midwifery services is not what actually students get out of it. So it's looking at the whole spectrum, sometimes looking at your role and seeing how you can have an impact, and always challenging yourself. What contributions are you having on the wider picture of race and inclusion in the workplace? Thank you.
Thank you, Jane. A couple of questions that are coming up was about what is cultural sensitive, cultural competence, cultural competency training? What is the minimum standard, and how do we make sure this is consistent across the UK?
Anyone want to tackle that question? I'll start and then other people can come in, but I think that's a really good question, actually, because obviously there isn't, you know, standardized package. I mean, lots of people have developed cultural safety training, or whatever you want to call it. You know, there might be different aspects to that. I mean, for instance, at the Royal College of Midwives, we've all just been through allyship training, you know, and that we feel is really important too. So I think there isn't one single package, but I suppose really it's about again opening up those conversations, making people aware of their own prejudices, discriminations, you know, however implicit that might be. And it's again about challenge, I suppose. But I suppose something that came out of the conference yesterday that really hit me was a presentation from Northampton, where a midwifery lecturer who was a white lecturer had been working with 2 global majority colleagues. And she said, I sometimes ask to share my colleagues' glasses. I put my colleagues' specs on. I asked to borrow her specs. You know, and it's that, isn't it? It's about trying to understand things from another perspective, and but you know, trying to do that with some just lived experience, I suppose, so that you can really see the other side. I don't know if anyone else wants to come in on that.
I was a hero.
I was just going to also add to that, in that sometimes it's the spaces that you hold as well. So at DMU, I remember when, you know, Maxine and I, when we've tried to have conversations around the subject, and there was a little bit of resistance, and then the university started their project around decolonising DMU, and that gave us a lot of courage. I don't know if you felt the same way, Maxine. So I think sometimes it's the spaces that you hold as well, and you might, you know, not take a straightforward path in trying to achieve what you're trying to achieve, and often it's leaning on other people who have more experience, who have been through these processes, to just understand, am I doing the right thing? Being really open about those, you know, having that open dialogue is really important as well. I don't know if you want to add anything to that, Maxine, but that courage, you know, it's really important to have that courage. And sometimes midwifery doesn't always allow us to have that courage. And a lot of that is to do with the representation within our workforce. But if you want to add anything to that, Maxine.
No, I totally agree. And it's that fine line, isn't it, that being a global majority member of staff and the burden that is sometimes felt by being the only one in the room. But I would always welcome conversation, let someone wear my glasses, see what it is, what is my lived experience. I'm always open to those conversations, but there are times when you are the only person in the room and comments are made. This is just anywhere in general, not just in the university setting, but, you know, I certainly find myself as the minority, and that can be tiring. And, you know, the students you want to support, the global majority students, we're in a diverse city in Leicester, so we're very fortunate in terms of access and giving our students the experience to provide care for global majority women. But I think as an academic lecturer, there's also that you want to, you know, make these relationships with all your students, but particularly global majority students, because you have that shared lived experience, but you are one person, and it's trying not to burn out, I suppose, but wanting to do your best. But I'm happy for colleagues to ask me. I don't have all the answers, but I certainly know what my experience is, and yeah, just to share that really.
Lovely. Karina, you had your hand up and then you popped it down again. Did you want to say something?
Yeah, it's probably been covered. I was just going to say, just as there is no single culture, it's almost impossible to standardize culture training, but you can approach it from various angles. For example, awareness that there are cultures around you, awareness that other things exist, like you say, look different via different glass. So then you get training around that, and then you can take it further, like some people take it further. How do I then now become an ally, do some allyship training or support people around me, which is now moving on to active bystander training? How do I actively support the people I look after, the people I work with, and the people around me? So it might be that it's a combination of training, but to standardize it might not really work out because there's cultures around every characteristic.
Lovely. We've got a couple more questions, but we don't have time. But I think that I'll just say that there's a lot more work that needs to be done in practice as well as the questions. That's the ethos of the questions to me. So perhaps we need to revisit this again. I get obviously the attendees, there's many of them in universities. I can see the names, but that we've started a conversation, and again, take it back, think about what we can do in education, remembering that education is 50% practice as well, and together, working together, having these conversations, we can do some good, so that all of our students are, well supported, and we're also meeting the needs of the women at the end of the day, because that's what we're here for. So thank you everybody who has contributed questions and to the speakers. It's been fascinating, real food for thought. And yes, we will see you all again on the next ones.